All right, so now we are going to finish the lower body and talk about the bones that make up the ankle and the foot, and then begin talking about the muscles of the lower limbs. So let's start on this side, which shows you the bones of the foot, and kind of work through this, and then I will take you to the other picture, which is color coded. So there's a couple large bones to start with. The calcaneus, if you remember from your anatomical terms, is the heel. That's the big bone that makes up the heel. And then there is the talus. This is another pretty large bone that makes up parts of the ankle. So the talus and the calcaneus make up parts of the ankle. And then we're going to work through the bones of the foot. So there's a series of small bones, and this is again just like the bones of the wrist. Just like the bones of the wrist, there are several small bones that make up more toward the proximal end of the foot. So it starts with two bigger bones. So there is the navicular and the cuboid bone. And then there's a series of three cuneiform bones, and they are named based on their location. So there's a medial cuneiform, an intermediate cuneiform, and a lateral cuneiform. So those are the bones that make up the ankle and the very proximal part of the foot. And then as we start to move closer to the digits, instead of the carpals, we have tarsals. So that's what makes up the ankle. And then we have the metatarsals. So again, instead of carpals and metacarpals, for the foot, we have tarsals and metatarsals. All right, and they are going to be numbered the same way that the bones of our digits were labeled. So just like our thumb was number 1, the big toe is number 1, then 2, then 3, 4, and 5. And this is all labeled here, but I'm just taking you through this image first. And then we have the bones of the phalanges, which are very similar to the way that I described them for the hand. So there's a distal, middle, and proximal phalange on the second, third, fourth, and fifth toe, but there's only 2 of those bones on the big toe. So let me highlight this for you here. So you can see the big toe only has the distal and proximal, whereas all the other toes have all 3 bones, distal, middle, and proximal. And they are named and numbered the exact way. So if I label any of these in the practical, so around the ankle, you would tell me the name of the bone. If I labeled one of the metatarsals, so if I labeled the second one, you would say that is the second metatarsal, or the third, or the fifth. And then the same is true for when I label the phalanges. You would have to tell me the number and then tell me exactly what bone it is. So if it's the first distal phalange or the first proximal phalange, etc. So work through that. And then on the other side, I have it where it's color coded, so you can see the numbering system here, down here. And then you can see the cuneiform, so there's a row of cuneiform bones. And then you have the bigger bones, the cuboid, the navicular, the talus, and the calcaneus. So those are the names of the bones that you'll find in the foot. In the lab, we have models of an entire foot, so you can sit and work through the names of these bones, as well as identifying the phalanges. All right, we have 3 distinct arches in our feet. that are formed. I'm going to show you which bones make up which arches, okay? So there are 3 of them. We have a medial and lateral longitudinal arch, and we have a transverse arch. And I'll show you pictures of those. It's important to note which bones belong to which arches. And then the arches of our foot are maintained by several things. One, it's maintained by the shapes and the way that the tarsals connect and come together. And then there is also a lot of ligament support and tendon support. I'm not going to go over all of the ligaments and tendons in the foot. I'm going to kind of show you a picture of what that looks like. But we are going to skip a lot of the ligaments and tendons because of time. Obviously, anatomy, we can go over everything and completely flood your brains, but we have to limit it somewhere. So let me show you what the arches are in a picture format, and then I'll go over and explain exactly which bones make up these arches. And these arches, as you probably know, are very important for maintaining correct posture and the way that we hold ourselves. And correct posture is also important for limiting back pain. So if our arches are not correct and we're not using orthotics to correct whatever may be wrong with the arches, if it's a fallen arch, you can have excessive back pain over time if you don't correct these. Because most of our body weight is being supported by our lower body. So these arches end up being very important in terms of muscle support and holding our vertebral column the correct way. So this picture is a nice picture looking down, showing you the different arches that I was just talking about. So there's the medial longitudinal arch on the medial side, a lateral longitudinal arch on the lateral side, so where the pinky toe is. And then there's a transverse arch that comes across. And you can see these in a lateral view, how these arches are maintaining our feet. So let's look at what all is involved and what are the bones of these arches. So this picture, it's a nice color-coded picture as well, showing you what the medial longitudinal arch looks like. All right, so medial, so this is the big toe right here. We'll call it the hallux. And you can see that the medial longitudinal arch includes the calcaneus, the navicular, the talus, the cuneiforms, all 3 of them, and then the first 3 metatarsals. That is what is making up the medial longitudinal arch. This is an image here showing you the lateral longitudinal arch. So we just went over the medial longitudinal arch. Here is the lateral. It's running down the baby toe side. So this arch consists of the calcaneus, the cuboid, and the 4th and 5th metatarsals, which are here and here. So that's number 4 and that's number 5. So you can kind of, draw a line and that would kind of cover that arch there. That would be the lateral longitudinal arch. And then finally, the transverse arch consists of the 5 metatarsals. So again, 1, 2, 3, 4, and 5. The cuboid bone and all of the cuneiforms, the medial, intermediate, and lateral. So it kind of spans, let me see if I can pick, it kind of spans this whole area right here. That would be the transverse arch. And so this is the picture that I was alluding to when we first started talking about the arches of the foot, and that there are several factors that contribute to the stability of the arches within the foot. So as always, muscle support is going to be the number one factor that helps to keep these arches secure. Secondly, you're going to find ligaments. So we didn't go over the specific ligaments, but there are many ligaments that will help stabilize these arches. There is also plantar aponeurosis, which is a fancy way for saying fascia, which is another way of talking about connective tissue. So there is a lot of connective tissue on the bottom of your foot that help to support the arches. And then finally, there's the support that our bones give us to help maintain these arches. And as I was saying, if your arches aren't properly maintained and you have a collapsed arch, it basically takes your entire body and it's completely out of whack. I mean, that's not a very technical term, but you can see that your spine is no longer aligned with the rest of your body. And that puts a lot of pressure and weight on all the wrong regions. And so you can end up with back pain, lower back pain, lower leg pain. But if you can correct those arches, and again, you can get orthotics, those are inserts into your shoe to correct those arches. That will help maintain proper posture so that that could eliminate some of the back pain that you're experiencing.